Hello all, I am Ann Craddock, and today we will be learning about peripheral edema as it relates to heart failure. We will discuss the etiology and the prevalence. We will talk about the pathophysiology of peripheral edema as it relates to heart failure. We will talk about clinical signs and symptoms, pharmacological and non-pharmacological treatments and care, and the ways to promote health and prevent this disease throughout our communities. So what is the etiology of peripheral edema? Peripheral edema occurs when there is any imbalance that is created within the vessel or outside of the blood vessel. So it can occur due to a change in the permeability of the blood vessel wall. You can have a disruption in the function of the lymphatic system that controls the flow of fluid in and out of the tissues. And you can have an imbalance in the pressure between the intravascular volume and outside of the vessel, and that causes fluid to shift. It is important, though, to note that when you have a patient present with peripheral edema, that it doesn't necessarily indicate the patient has heart failure. You have to make sure that you take the time to have an appropriate history and physical obtained so that you have an understanding of their medical history, what medications they're taking, because you can have edema that's caused by a blood clot or by medications. It could be medication related. They could have had a history of cancer and received radiation treatment. There's a whole host of things that can cause peripheral edema, so make sure you're getting an appropriate history and physical. So when you are assessing your patients and you find peripheral edema and you're considering the link between this edema and a potential diagnosis of heart failure, you want to make sure you are looking over all of your diagnostic testing, because to come up with a diagnosis of heart failure, you want to tell your patients as early as possible. You want the correct diagnosis because heart failure is life-threatening. It is progressive, and if you're able to diagnose this early, these patients can potentially make changes to their lifestyle, make changes to their diet, make medication changes or implementations to reduce their symptoms and slow the progression. So all these other findings are typically, when you see them all together, it is consistent with a diagnosis of heart failure. So when you see a patient who has jugular venous distension and you see both sides of their neck on their assessment and there's a lot of swelling and dissension, when the patient is complaining of dyspnea on exertion, or if you're trying to boost that patient up in bed and you can't lay their head down, if they always want to be propped up with pillows or sitting upright, if they're having orthopnea, they say they can't sleep at nighttime laying flat in a bed. That is another finding. Peripheral edema, when you see it in a patient with heart failure, it is typically noted bilaterally, so both legs. It's typically pitting, so when you're doing your assessment of 1+, 2+, 3+, 4+, when you're seeing patients with heart failure, you're typically seeing pitting edema bilaterally. It's not on one side, it's on both. When you're listening, when you're auscultating with your stethoscope, you're hearing crackles in the lungs. There's potentially changes on their EKG, and you're noting weight gain. So patients are having huge shifts in fluid. And obviously, you're going to look at blood testing. You're going to look at your BNP. You're going to see changes on your chest X-ray as well. So in the United States alone, heart disease is very prevalent. So if you're going to see a patient with peripheral edema, you want to make sure you are diagnosing this correctly because it is very prevalent. It's seen very often in the US. Heart disease affects about 6.5 million people in the US, and numbers are expected to climb if there aren't more efforts put into prevention and education regarding diet, exercise, and medication management. So the hospitalizations that result from the diagnosis of heart failure costs of roughly $40 million each year. So preventing this disease is key, and management of symptoms and having patients educated and understanding how to manage their heart failure is very important if this is to be the diagnosis. So before I relate the pathophysiology of edema to heart failure, I would like to first mention that there are multiple factors that can cause heart failure. You can have heart failure as a result of high blood pressure. You can have heart conduction problems, which can cause heart failure, problems with your kidneys. You can have heart injury as related to an MI, requiring heart surgery or not requiring heart surgery. If there's damage to the heart muscle, you can have problems with your heart valves. You can have a side effect from medications. All of these things can cause heart failure because what all of these factors do is cause difficulties in the ability of the heart to provide blood flow to your tissues. So if there's something obstructing blood flow and it's making the heart unable to provide the tissues of the body with what it needs to meet the demand, you can have a shift in the way fluid goes across those membranes. So changes in pressure over periods of time cause injury to the vessels, and it causes fluid to leak into the interstitium, and that's what causes this peripheral edema, which is a big symptom of heart failure. You have to then go forward and try to identify the cause. What is this patient's history? What was the cause of this change, this physiological change, and how do we then treat it? So this diagram here takes you through these different adaptations of the body when there's all these issues that can take place, and there are many. So I just wanted to touch on that. So when you're evaluating your patients who have peripheral edema as related to heart failure, what you want to evaluate is the degree of peripheral edema. And to do so, what you're going to do is you're going to push your thumbs into the area that is affected, and you're going to hold it for about 5 seconds. And what you're doing is when you release your thumbs, you're evaluating how long it takes before the skin returns to the state that it was when you started. So if you have a patient who does not have any degree of pitting from you applying your thumbs, then you're going to designate that as a mild case of peripheral edema, which would also correlate to potentially a milder case of heart failure, versus your patients who have severe pitting or potentially weeping of their edema. You would designate that as a more severe degree of heart failure. Another clinical sign and symptom is your dyspnea. So your patients who are having shortness of breath, whether or not they have dyspnea at rest, those patients would be designated as having a more severe and advanced degree of heart failure versus your patients who only have dyspnea with activity. You have patients who may have an inability to lay flat, which would indicate that there is a significant amount of fluid in the lungs, indicating advanced heart disease. You also want to encourage patients once they are discharged, since there is such a high degree of hospital readmissions for patients with heart failure, you want to teach them about how following their weight and increases in weight can indicate that there is an ineffective means of medications, and maybe they need to have an adjustment, and they should be getting in to see their physicians to discuss that if they're noticing changes in their weight when they're at home. So when you're assessing your patients and you're deciding upon pharmacological treatments and care for peripheral edema as related to heart failure, you want to look at whether this heart failure is acute versus chronic. The treatments for acute heart failure, and some of these can certainly overlap, but loop diuretics such as Lasix, furosemide, torsemide, those are more potent. So those medications are typically used when you have a patient presenting to the emergency room and they're having an acute exacerbation of their heart failure and they have a significant amount of fluid in their lungs. So they're going to be given typically a dose of loop diuretic, and that's going to be potent. It's going to work on getting fluid out. And you know those patients that complain about the amount of times they have to get up to go to the bathroom, but it's going to be what's going to act the quickest in regard to their heart failure. For patients who have a chronic maintenance type heart failure at home, they're going to probably be prescribed a thiazide type diuretic for chronic heart failure, so the hydrochlorothiazides, spironolactone. Patients may go home on a loop diuretic as well, because if patients have more advanced disease, they may need something more potent to be managing their heart failure symptoms at home. Another thing you want to think about are medications that could be causing the edema as well. So calcium channel blockers, beta blockers, these are medications that can cause peripheral edema, can weaken the heart muscle over time. They cause shifts in the way fluid moves across the cell. We talked about that in the beginning. Diabetic medications also, especially taken in addition to calcium channel blockers and beta blockers, when you add multiple medications for multiple comorbidities, there's an even more increased risk of peripheral edema and worsening heart failure. So this is going to bring us to our next slide, where we talk about prevention and talk about other ways that are non-medical that we can treat heart failure. So when you are talking to your patients about non-pharmacological treatments and care for their peripheral edema related to high blood pressure, what you want to talk to your patients about are being compliant with the medications that they're prescribed. So I know there are a lot of patients who don't want to take their diuretics at home because of the inconvenience of having to go to the bathroom frequently. So these are all things that can be discussed, even though it's talking about medication. Compliance is really important as far as compliance regarding their diet, as far as exercise. That is also really important. And you want to talk to patients about keeping their legs elevated. So if patients are told that when they keep their legs down, all these dependent areas will increase the amount of swelling. So if they lift their legs above the level of their heart, it's going to decrease the amount of swelling to their extremities. So that is an important point to talk to patients about. Another thing you can talk to patients about are compression stockings. The use of compression stockings can help to provide an external pressure to these areas with edema. There's different levels of compression, so the higher the level of compression, depending upon how much edema they have, that can make a really big difference for them as well. So nurses can play a much bigger role in the promotion of health and the prevention of disease in our communities. And we have to start small sometimes in order to have big results. But heart disease and diabetes and obesity, all of these things can largely be prevented with small shifts in our communities. So education, playing a bigger role, having talks at schools with kids, and having talks with our patients that we're caring for, and making sure they're educated and understand that what they do does impact how the disease will progress, having people stop and limit the amount of alcohol, stop smoking, and as far as eating less meat and increasing the amount of plant-based foods in their diets, less salt, more exercise. You got to get moving. People need to understand that the body is made to work, and it really wants to work hard. And if it doesn't, then it's going to not be strong, including the heart. The heart is a muscle, and it needs to work. So educating, promoting, living through example, these are all things that can be done in order to promote a much healthier society and a much healthier community that we live in. I hope you all learned something from watching my video. I hope that we all are able to make and empower people to make small changes that end up paying dividends in the future. These are my references, and thank you for watching.